I wanted to bring today's episode to the podcast talking about the thyroid. This is something that we regularly see with the couples that we work with that are dealing with low AMH and high FSH, diminished ovarian reserve, and premature ovarian insufficiency is the thyroid. And so we see hypothyroidism, we see subclinical thyroid issues, and we see Hashimoto's. And so today's talk is a deep dive into all things thyroid. We talk about the diet and lifestyle changes that can impact thyroid, what to do if you've been told your TSH is normal, but you still have those classic thyroid symptoms, such as your hair falling out or feeling dry, your skin feeling dry, and your hands and feet are cold, and also if you have constipation. So lots of things to do to help to optimize the thyroid. We talk about medication, the lab values, what to ask your doctor for, and what to do if you're just not getting help. So excited for you to listen to this episode. Let's go. Hey there, I'm Sarah Clark, founder of Fab Fertile and your host. I believe the functional approach is the first step for anyone on the fertility journey, and my aim is to help you get pregnant naturally. Today, I'm welcoming Dr. Amie Hornaman to the podcast, and we're digging into the thyroid and its impact on fertility. Dr. Amie Hornaman, aka the Thyroid Fixer, is a woman on a mission to optimize thyroid patients around the world and give them back their lives using her proprietary transformational program, the Fix Method. She's also the founder of the Institute for the Fix Method. She is also the founder of the Institute for the Thyroid and Hormone Optimization. She's a doctor of clinical nutrition as well as a leading functional medicine expert in thyroid conditions. Thanks so much for listening. I'm so thankful that you're here. Make sure you hit subscribe or follow. And if you know someone else who is on the fertility journey, please share this podcast with them. Hey, Dr. Amie, excited to have you on the podcast.
Hi, Sarah. Thanks for having me.
Awesome. Can you share your journey of how you came to do this work?
Oh, yeah. Like most of us,
Right.
Pain to purpose story, something happens to us and then we help other people. So this started way back in my 20s when I was actually regularly doing competitions, figure competitions. And I by no means come from a skinny mini family. So I would always have to bust my butt to get stage ready, really diet down, get nice and lean, strict diet. You're going to the gym a couple times a day. And I had done plenty of them in the past. There was one in particular, though, that I'm starting to get ready for. And it just biologically didn't make sense that the scale kept going up. I'm like, this isn't right. And I always preach that we know our bodies. You know your body. You know when something is off. And so I'm like, this isn't supposed to be happening. It's never happened before. And like I said, it just doesn't make sense based on what I'm eating and how I'm exercising. So I start doing what we all do. I go to my doctor and I tell her at the time, who it was actually my sister. So I blame my sister for the first misdiagnosis. She was a geriatric doctor, but you figure you got a doc in the family, like, hey, sis, can you help me out? She goes, everything's fine. So then she refers me to her partner. I get referred to metabolic disease associates, a couple endocrinologists. All of them are telling me you're fine, you're normal, eat less and exercise more. To which it's virtually impossible for me to eat less and exercise more at that particular point in time. So 6 doctors later, I finally land on doctor number 7, who touches my throat and says, swallow. That was the first one. And she goes, well, you have a goiter. We're going to ultrasound it and you have hypothyroidism and here's a medication. So, I leave and I'm pumped. I'm like, yes, there's a pill. I'm going to get my energy back. I'm going to lose weight. I think my hair was breaking off at the time. I was like, this is awesome. Well, it was Synthroid and it did absolutely nothing in 5 months. So I go to Dr. Google like we all do right now. And I go back to her and I'm like, and this is long before I got into functional medicine, but this is how I got there. I go back to her and I say, there's this thing called T3. Looks pretty cool to me. Could we combine this? Because it turns out it really works. She goes, I don't do that. I said, I'm going to find somebody who does. And I kept hearing the name. A lot of my patients would be like, I found you through divine intervention. I believe in that because I kept hearing this name. So I go to the functional medicine guy and that I kept hearing about, and he saved my life, became my mentor. I studied under him. He changed the whole trajectory of my career. And then I went on to get certified in functional medicine, got my doctoral degree, got my master's, got my doctoral degree, worked under him and really learned how to help a person and dive into their labs and look at all aspects of their life. And he was functional before we even used the term functional. He was, I think he had integrative or holistic or whatever in front of his name. But the approach that he took literally saved my life. If I had not found him and went down that road, I would have started thinking I was crazy and I would be 300 pounds bald and tired. I mean, he literally changed my life. So that's what led me to now helping people, because I know there are so many women and men, mostly women, that are going misdiagnosed and undiagnosed. And how many stop at doctor number 2 or 3 or 5 and eventually think, well, 5 doctors have told me I'm normal. Maybe I'm just getting older, or maybe I'm crazy, i.e. medical gaslighting. Maybe I'm crazy and it's just all in my head. And a lot of people do stop there, and that's why they stay stuck with all the symptoms. We can't allow that to happen.
Exactly. I think it's like common, but not normal. That's the same for me, where I have my hair was as dry as a straw.
Yep.
My hands and feet were freezing. My skin was dry, and oh yeah, your thyroid's fine. Everything's good. It's at 3.5. Like, you're really good.
Oh yeah. You're
Yeah.
good. Yeah.
So, so we deal obviously with couples that are on the fertility journey. The majority of people we work with have either hypothyroidism, Hashimoto, some grays, but more Hashis, or subclinical thyroid issues. So this is a huge topic for us to dig into today, and super important. Conventional medicine, we'll just typically look at the TSH and not dig further, not look at a full panel. And then you start thinking, yeah, that medical gaslighting that, oh my goodness, it's all in your head. And, these symptoms, everything's normal, you're fine. And you're wondering why, you're struggling to conceive. So first of all, so why is it important to optimize your thyroid if you're on the fertility journey, or if you've had miscarriage as well? Why is that important?
Yeah. I see that so often in my practice too. And usually I'll see you get them in the beginning. I see them after they've had all of the miscarriages and just have given up, really. Or I'll see 50, 60-year-old women that tell me about their history of trying to conceive and just how horrendous that was. But the thyroid is the master gland. So we have to remember that. And it doesn't get enough love in conventional medicine. If you just say without thyroid hormone, you'll die. Boom. That's how important the thyroid is. Since it's the master gland, it controls every function in our body. Every single cell in our body has a receptor site on it for thyroid hormone, specifically T3. And without it, that organ, that system, i.e. the reproductive system, cannot work to its fullest capacity. So number one, it's controlling all the sex hormones. Estrogen, progesterone, testosterone, DHEA, it's controlling your adrenals, it's controlling everything, your insulin levels. So if the thyroid is off, it's going to start making those sex hormones go wonky. And I don't care if you're in your 20s, in your 30s, in your 60s, those sex hormones start to fluctuate and go really, really crazy. And oftentimes, and you probably see this too, Sarah, I will see 20-year-olds with a progesterone level that of a postmenopausal 70-year-old woman. And you cannot conceive with progesterone levels that are postmenopausal, FYI. So that's a big piece of the puzzle. I'll see testosterone levels in the tank. I'll see insulin levels through the roof. So sometimes there's a polycystic ovarian syndrome kind of correlated. Sometimes it's just, independent, that the testosterone is low or high. So we see the sex hormones basically go crazy. We see insulin go crazy, which can elevate testosterone then and push them, basically trigger that PCOS kind of condition. The insulin resistance that accompanies hypothyroidism is also very inflammatory and makes it very hard to conceive. And then when you do conceive, here's the miscarriages part. The body needs that thyroid hormone in adequate amount. So it's using some now to make a baby. And your baby needs thyroid hormones too, inadequate amounts, because without it, and with an undiagnosed hypothyroid problem, that's where we see increasing risk of autism, developmental delays, childbirth defects, and or just a miscarriage because the body says, not ready. That's why we have to, and I'll tell my patients flat out that are like, well, I think we're going to try to get pregnant soon. I go, just wait for now. Give me 6 months to a year. Let's get you, and really 6 months, let's get you optimized. Let's get your thyroid optimized. Let's work on your hormones. Let's lower the insulin if that's the case. Let's do it all so that you are that beautiful, healthy, ready for a child body that you should be, instead of hurrying up the process and possibly running into some heartbreaking complications.
Absolutely. I know we spend, 12 months to 18 months planning the wedding. Why don't we switch that around? And then we want to have the baby the first month. Let's switch that around. Right. And the fertility industry kind of perpetuates this panic of like, oh my goodness, you're too old. Your eggs are old. You had better rush to IVF right now. Go, go, go. This is your last chance. Your geriatric, age that it'll never work. And so it just, basically waiting that minimum of 6 months to then have a healthy pregnancy, postpartum period, postpartum, the health of your children is key. It's hard though when you're right there and you're like, oh my goodness, this looks like the quick fix, right? And then, but is it? Like, so for me, I had both my kids with donor eggs. Years later, I discovered food sensitivities and gut infections and chronic stress. And
yeah,
that's why I'm helping, couples that have low AMH and high FSH, diminished ovarian reserve and premature ovarian insufficiency, get pregnant naturally. Or if they do go to the clinic, if they've been told donor eggs, it actually works. And because I didn't get a second opinion, I had no clue that any of this stuff was connected. And then my health took a complete nosedive, similar to sort of that dark night of the soul. You're like, wait a minute, you find this. And then you start a podcast because you're like, I gotta tell people about it.
I know. I can't wait to have you on mine because people need to hear exactly. People need to hear this. I never heard your story before, but I can't wait to dive into it because you're right. I mean, this is that hidden knowledge that you might not even find on Dr. Google. Honestly, I mean, really takes diving into experts like yourself where you find that information that when you hear it, it clicks and it makes sense. And you go, oh, that's totally me. Oh, wait, my mom had hypothyroidism and my sister has Hashimoto's and my aunt had her thyroid removed. Maybe that's why I can't get pregnant. And maybe that's why I had like 2 miscarriages. They start to piece it together when they hear it. But until then, you're not going to find it on Dr. Google.
It's so interesting about the family history because my mom, she's got great health, but we were like kind of somewhat vegetarian growing up. I ate like super healthy. And then she became a vegan back like 35 years ago when it was not cool. And everyone thought she was a weirdo. And now of course it's, plant-based being all the rage.
Right.
But in that she just pounded back all this soy. And then lo and behold, the thyroid goes in, problem. Doctor's like, you got to take half that thyroid out. And I remember her going in, she was very like always consulting the Merck manual, always like, stay away from doctors. Don't let them get near me. And then she went in and she had it taken out, like half the thyroid taken out, and she's not on medication. And now her memory is, I'm like, your memory's off. And she thinks she's got all, I'm like, your memory's off because the thyroid, but and now she's somehow just kind of forgotten the fact that she was like this trailblazer back in the day. And I'm like following now conventional medicine. Her memory's still like, she's still functioning and she's fine. But like just that she has some major brain fog on all this stuff because half the thyroid's gone. And so we see that a lot too, where I'll ask, oh, how's your, does your mom, how's the health of your parents? And someone typically has thyroid, or how's the sibling? So it's interesting. Can you talk about that family link?
So normally we see that with Hashimoto's. So let's start off by saying, if we take all the hypothyroid cases out there, 90 to 95% of them are going to be Hashimoto's, which is autoimmune. So it's Hashimoto's thyroiditis. And that is caused by your immune system thinking that your thyroid gland is an invader. I always use the analogy of little soldiers. You got these little soldiers, and those TPO and TGA antibodies tell you how many little soldiers you have. And they like to go out and wage war and beat up your thyroid. So, listen, they're just confused. They're just confused. And autoimmune, we're seeing increased rates of autoimmune conditions just across the board. I mean, all autoimmune, rheumatoid arthritis, Crohn's, celiac, across the board. Like you said earlier, you mentioned, toxins and environmental exposures and underlying infections. We're seeing those autoimmune conditions, or that autoimmune switch, think of it like a light switch. We're seeing that turn on so much more these days because we are exposed way more to all kinds of garbage. I mean, so back in our day, even when we were young, we didn't have to pay attention to the amount of glyphosate that was sprayed on our tomatoes. I went to the local strawberry farm or the local tomato farm and picked them and put them in we're just, and hormones and beef, and now, everything's in plastic. And so we're just so hyper exposed to chemicals. And then there are the underlying infections like Epstein-Barr virus, Lyme disease, that are so very common. I mean, I even tested myself for EBV. I go, oh, look, there it is. No wonder I have Hashimoto's. It wasn't active, but it was dormant. But those kinds of things are precursors to flip that switch. And another big one is stress. Now, I will hear my patients, I would say, again, probably about 50% of them will say, it was after my second kid that everything went to hell. Well, pregnancy is a stressor on the body. It is a natural thing. We want it to happen. We want it to be as easy as possible on you. It's still a stressor on the body because your body's making a life. So sometimes just pregnancy alone is enough to go boop, and we flip that switch in the on position. And then after the pregnancy, after you give birth, then it's like it all goes to hell. Hair falling out, can't lose the weight, tired all the time. And at first we think, and I've heard this term used by conventional medicine, it was, postpartum thyroiditis or something. And it's like, no, it's called Hashimoto's. It happened postpartum, but it's going to keep happening. It's not going to magically disappear when the child's 1. That woman is going to continue suffering with symptoms if we don't test thoroughly and do something about it to make her better now. Oftentimes it's seen after pregnancy as well. But it comes back to that autoimmune condition being so prevalent and so genetic, to answer your question, very, very genetic when it comes to autoimmune. So when you see that history, mom, sister, aunt, grandma, that it really gives a key, even if that person is not officially diagnosed, but they're presenting with all the symptoms. There's a pretty good chance that you have Hashimoto's too, because the rest of your family does, and you have all the symptoms for it. So it's very, very hereditary.
Yeah. And and then it could be missed, right? You're just, again, the gaslighting piece. Yes. Let's talk about some of the factors that will inhibit the thyroid. So we talked a little bit about stress and some gut infections, but you kind of go into some detail about sort of the things to watch out for.
Oh yeah, there's so much. So I talk a lot about low testosterone. A lot of people don't pay enough attention to testosterone levels, especially in women. We do have testosterone. It's very, very important. When it is low, that actually sets you up for Hashimoto's. So it lowers the body's protection against autoimmunity. And oftentimes all it takes is those testosterone levels to drop low. And I don't mean below the standard lab value range. I mean low as in less than 40 of the total testosterone. So that's where I like my ladies to be, 40 to 50 or above. Some people feel great above 40 to 50 or above. If it's lower than that, that can be a trigger. Estrogen dominance, toxic burden, stress, adrenals, underlying infections, Epstein-Barr virus, Lyme, herpes simplex, all of those viral infections. Medications can tank the thyroid. I mean, there's just so over exercising, under eating, so starvation diets, eating disorders. And a lot of women will do the exercise under eating thing because the hypothyroidism, the Hashimoto's is causing the weight gain that they're losing their minds over. And no matter what they do, they can't lose. So they go on every diet under the sun and they crush themselves at the gym. Well, that alone is just making the whole situation worse. So there's so many factors that affect the thyroid gland. I think that's why we really have to step back and check it, because we're living in a world of stress. We're living in a world of toxins. We're living in a world of being exposed to various like heavy metals and medications. And I mean, that's just the reality. So if that's the reality and we know that that can affect the thyroid, then let's check it, and let's check it thoroughly.
Yeah, so let's talk about some of and you've got a free download for the listeners at the end. We'll talk about some specific things to look at. But as far as, so typically people will just get the TSH, looked at. They'll be told it's normal because it's, below 5. And then no one even goes deeper. And it's even harder to get your physician to run the full panel. So you kind of talk about why it's important to look at the full panel.
Yes. So TSH, you're right, Sarah. Most of the time you go in and you say, hey doc, can I get my thyroid checked? You'll get TSH. That is thyroid stimulating hormone. That is a pituitary hormone. That is not a thyroid hormone. Now, we have to remember that the hypothalamus talks to the pituitary, that talks to the thyroid. If the hypothalamus in your brain and pituitary in your brain think that there's not enough thyroid hormone in the body to do the job, it's going to start screaming at the thyroid gland. So think about when your kids don't listen and then you raise your voice and you get a little bit louder and then you're really shouting at Johnny to pick up his damn toys. So that is the pituitary shouting at the thyroid, using thyroid stimulating hormone to poke it and say, you got to wake up and do your job. That's when TSH will go up. Think the higher the TSH, the louder you have to yell, the less the thyroid is listening. So high TSH means low thyroid function. If it's screaming, then obviously there's a problem, and your doctor may or may not actually look at it as high and say, hey, you know what? There might be something going on here with your thyroid. That's just one marker though. And that can actually not be screaming, and it can be in normal or even functionally optimal range, but there still be a problem. So we have to keep testing. Oftentimes you'll also get a free T4. Now, let's just break down the thyroid hormones. T4 is inactive, totally inactive. T3 is active. So T4 does nothing. It just has to convert over and become the active form. T3 is what gets into your cells. So I said earlier, every cell in your body has a receptor site on it. It has a receptor site on it for T3, not T4. So we have to look at free T3 levels. I want to look at your free T4 levels, free meaning unbound, ready to be taken up, biologically available. Free T3 tells me how much of that active thyroid hormone is biologically available to get into your cell, to grow your hair, to strengthen your nails, to give you a good mood, to let you poop every day, to help you lose the weight. Free T3. Now, beyond that, we want to check reverse T3. That is anti-T3. That's the bad guy, essentially. Well, it's not really bad. Our bodies had this survival mechanism built in. It's called reverse T3. And the reason why we want it there is because if you end up in the ICU or the ER with a traumatic injury and infection, that reverse T3 is going to go up to protect you, to keep you alive, because your body knows during times of crises or trauma or injury, you don't have to grow your hair. You don't have to lose weight. You don't even have to think or be in a good mood. You need to survive. So reverse T3 will go up in those settings. I don't want reverse T3 up when you're trying to run around and live life and work and take the kids to school or whatever you're doing. So we have to check reverse T3 to make sure that your brakes aren't on, and to make sure that your body is converting that T4 over into the active form of T3. Then we do one more step. We have to check for Hashimoto's. We have to check for that. So we check TPO, thyroid peroxidase, and TGA, thyroid globulin antibodies, to see if those are present. Now, again, conventional lab value ranges, standard lab value ranges. And I don't care what country, even in Canada, they are wide and vast, and they are taken from a group of sick people. So we don't go by that standard lab value range. We go by optimal ranges. And that's the download that you're talking about, Sarah, is where I have actually the optimal, what labs to get and their optimal ranges, because it's important. I hear so many people, I'm sure you do too, say, well, my doctor told me it was normal. Well, yeah, that's because it fell into that standard lab value range that was taken from sick people. So sure, you can fall into that range. That doesn't mean you're going to feel good. And that doesn't mean that there's not a problem. Because if that free T3 is low or your brakes are on, the reverse T3 is high, that's a problem. If there's any indication of an antibody, I don't care if that lab value range for TPO says that you're normal as long as you're less than 34. If you have 20, you have 20 soldiers that are beating up your thyroid. What are we going to do? Are we going to wait until you build to 50 to maybe pay attention? So now you have 50 soldiers. Oh, and you're 50 pounds heavier and you can't get out of bed. So now we'll pay attention to you. No, I'm going to pay attention to that 20 and say, listen, there's some autoimmune here going on. We want to reel this in right now to not only get you feeling better and reduce your symptoms, but to stop that autoimmune attack. So it's very important to get the full picture. I honestly don't even know how doctors operate without the full picture. I mean, you are literally playing a guessing game with these people, telling them that they're normal, and you don't even have all the answers. So we need them. We need all the answers. All the answers.
Yeah, it's interesting with the because below a certain threshold for those antibodies, and people are like, everything, there was some there, but there was a problem. I get that question a lot too. Did you want anything else you wanted to add on that?
So what you mean with the antibodies specifically,
the
or more testing?
Yeah.
With the antibodies, yeah. They also often come back as a false negative. So we know that eating gluten will increase those antibodies. There's a variety of different things that can increase the antibodies too. I mean, stress, you could have been sick. Those all can increase the antibodies. So let's say you're good, you're living a clean lifestyle, you've gone gluten-free, maybe you're dairy-free too. You're reducing stress. You haven't been sick in a while. Those antibodies might be at 0, but that doesn't mean that you don't have Hashimoto's. It means we need to check again. We need to do that family history to see if autoimmune is present. We need to do your history to see if you have any other autoimmune conditions, because it's very rare that we see just hypothyroidism alone without it being connected to Hashi. I mean, we do see it. Like I said, someone can be, maybe they were an over-exerciser, over-dieter for years and years. That can tank the thyroid. Maybe they went through chemo, radiation. That can tank the thyroid. They're on a beta blocker medication. That can tank the thyroid. So there's a couple things, and that's really in that like 10% that we'll see that primary hypothyroidism. The rest is going to be Hashimoto. So I like looking at the antibodies multiple times. And then, like I tell people, listen, it's not going to really change the way that I treat you. My goal is still to get those thyroid hormone numbers up, specifically the T3. I want that optimal, and to keep your reverse T3 down, and to get you feeling better and getting rid of your symptoms. So I'm not going to hyper focus on your antibodies and we have them at 0. And then it's like, okay, you're done, you're healed. And the person's still like, well, wait, I still have all these symptoms. It really does come back to looking at the actual number of thyroid hormones and pairing that up with the symptoms to optimize someone, because antibodies can go up and down and sideways. And, I've had patients that go, oh my gosh, they raised by 50. I go, oh, okay, how you feel? Good. All right. Well, then we don't need to worry about it. Just make sure you weren't gluten at a restaurant or something like that. So they give us diagnostic criteria, but they're not going to really change the way that I treat you. I'm just going to hammer down harder that you have to be gluten-free because of that autoimmune condition. But I mean, we all should be gluten-free. So it just makes the hammer hit a little bit more. That's all.
Yeah. Let's talk about the connection with gluten and thyroid.
It's fascinating. So there's something called molecular mimicry. And that is where, like I said, you have these soldiers, right? They go out and beat up your thyroid. So I always tell people, listen, if I came over to your house with a baseball bat in the morning and beat you up, you wouldn't work really well that day, right? You'd probably want to lay on the couch and heal. Okay, well, that's your thyroid when it's getting beat up by these soldiers. So now you eat gluten. Here comes gluten. It actually looks like, to your soldiers, it looks like the thyroid gland. Now, remember, thyroid gland is the bad guy to your soldiers because they're confused. So you eat gluten, it comes in, and your soldiers go, all right, it's time for war. We have an invader. So they go out and they're in their fighting stance and they're beating the gluten up, and then they go over and they beat your thyroid up. So you basically are bringing on an attack of your thyroid when you eat gluten. That's why it's so important. Now, let's say you don't believe me and you eat gluten on a daily basis. Well, your symptoms are going to get worse because as your thyroid is beaten up, it starts to shrink. So we can actually see that on ultrasound to determine Hashimoto's. The thyroid starts to change shape. It actually looks like it starts to get beat up and it shrinks down. Well, if it's not working well and it's shrinking, it's not going to produce the T4 and T3 that you need to run your body. So right there, that's a problem. Symptoms increase. And then on top of that, you risk other autoimmune conditions. So with Hashimoto's, there's stages of Hashimoto's. When you get to that end stage, that's where it has gone so uncontrolled that now we start to see, because with autoimmune begets autoimmune, where we see one, we see three or more. So we start to see other autoimmune conditions happen too. And that can occur from just, blowing off the whole, hey, don't eat gluten if you have autoimmune. And that constant exposure can actually spur on an autoimmune attack. And not only that, yes, gluten looks like the thyroid gland, but we also know that it destroys the gut. It causes leaky gut. It actually causes the tight junctions in our GI tract to open up. And without getting too deep in the weeds of science, it allows the bad guys through. And when the bad guys get through, they wreak havoc on your body too. And they create inflammation too. So now everything is inflamed in your body because here comes that gluten and it created a hole in your gut. And now things are getting into your bloodstream that shouldn't be. And that's where you see additional problems on top of the thyroid problems. Now you have a whole slew of other issues too, all from just that little molecule.
Exactly. So if anyone's listening here and that is the smackdown on gluten, which I've talked about on the podcast many, many, many times. I am gluten, dairy, corn, and nut free. So, but doing this in the very beginning, I've been doing this like that, eating that way for about 12 years or so. In the beginning, it was challenging. I was like, are you kidding me? I can't eat gluten. What am I going to eat?
Right.
At the time I started off on an anti-candida diet and was craving maple syrup like you wouldn't believe. So that didn't last too long. But like the diet piece is key. And I think sometimes people get a little confused on it and they're doing gluten light or dairy light and you're still having it. And if you're, and most of the people that we work with have that non-celiac gluten sensitivity. So when they do a Zoomer or they do one of the food sensitivity test, it's off the chart and super high. And so, as you then start to reduce inflammation, you take that out of your diet and things start to, come back into order. And so and as far as Graves, so we don't see as many people with Graves, but what's your take on that one?
Yeah, I don't see many people with Graves either. I'll see them after it has swung to the other side and they have been given, large amounts of methimazole. They've had their thyroid removed or radioactive iodine. So I'll catch them on the other side of the swing where now we have to replace the thyroid hormones that are no longer there because the thyroid's gone. Graves is an autoimmune condition as well. I will see Hashimoto antibodies with Graves antibodies. And sometimes my best friend's mom had Graves and I worked with her and we tried so hard to stop that swing. Now she wasn't 100% compliant either, but I would literally see her go from a truly hyper state to a deep hypo state and then back again. And it's like, we couldn't get that medication piece right. We couldn't really get her behavioral and eating and lifestyle patterns right. So it just kept swinging. So she had to have it radioactive iodine. And now we just start at 0. which is not a problem. I mean, if you have to have a thyroidectomy, if you have to have a partial thyroidectomy, like your mom, if you have to have radioactive iodine treatment, although I would go for the thyroidectomy rather than REI, then you do. And then we deal with it. And the most important thing there is replacing the hormones properly. So what I'll see with Graves patients post TT or PT or RAI, they'll be given Synthroid, just like I was all those years ago, T4. It doesn't even make sense. If you remove the gland that once produced T4 and T3, because your thyroid gland does produce both, and your thyroid gland is the main conversion gland. So remember, we said T4 is inactive, T3 is active. T4 has to convert to T3 in order to get to the cell with the receptor site on it. Well, your thyroid gland is the main conversion gland. Now we have some T4 to T3 in the liver, in the gut, and peripheral tissues. It's not the only way to convert, but it's the main gland. So if we just use basic logic here and we take out the gland that produced T4 and T3, and we take out the gland that converts T4 to T3, and we give you T4, how's that going to work? That's not going to work. We have to replace both thyroid hormones that were once there. So it really is about proper hormone replacement therapy. I don't even like to use the term medication. It's about proper hormone replacement therapy, in addition to, looking at insulin, balancing hormones, taking down inflammation, addressing the gut, all of that. But with Graves post removal, it's about getting that optimization, getting those numbers and that right level of thyroid hormone replacement therapy, so the person feels like a human being again and feels like their best self again.
And what if someone is, they've just been recommended to remove the thyroid? What would you say to them?
For me, it all depends on the reasoning. So listen, if you've been told we have to remove your thyroid because you're like my best friend's mom and you're swinging like that. If you have cancer, listen, what are we going to do? You might have to have it taken out. Now you really have to do your research though, because a lot of docs are surgically happy and they remove it just because they can't get it balanced. They can't figure it out. Or you have a couple nodules. Well, nodules are usually a result of low iodine or non-optimized hypothyroidism. So we can optimize you. We can try iodine. We can try all the nutrients of conversion. Let's take down inflammation. Let's find out the why. It's all about the why. I'm not going to override a doctor that says we have to remove it because of cancer. Okay, get it out. And then we'll take care of it on the other side of getting the person optimized. But I would never tell a person not to do it, but it all depends on the why.
And what about the connection with stress and the thyroid? I know personally and I always say I'm not stressed, which is yes, we all get stressed, and just because we can cope with more, and then as certain times maybe you can't cope with as much as you used to, and so for me the first sign is the hair starts dropping out, and so what do you see with stress and the thyroid?
So whenever we talk stress, we think number one, inflammation. So that's like full body inflammation. So if you think when you're all stressed out, your body's like a ball of fire. So of course, that's going to affect how the thyroid gland works. It's going to affect nutrients getting to your hair. It's going to affect everything. That's why we say stress is the silent killer, because nobody talks about it, but it's doing a number on the inside. When we talk about cortisol and the adrenals, so everybody says, I have adrenal fatigue, I have adrenal burnout. That may or may not be true, but we do know that T3 in the thyroid, active thyroid hormone, T3 needs cortisol, cortisol needs T3. So if we're seeing a very low cortisol pattern where someone's adrenal glands really are burnout, they can't even handle stress. They can't handle stress of any kind anymore. Usually that will cause the T3 to be low as well. And we can use T3 at certain points of the day to get that cortisol up out of the basement, in addition to glandulars and adrenal support and, de-stressing and all that. So we can use T3 to help the adrenals. Now, if someone has a super high cortisol, they're in that fight or flight mode all day long. Bang, 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 bang. Their cortisol is super high through the day. Well, we have to lower that, because now cortisol will increase reverse T3. Those are the brakes. Remember, that's the brakes. That's your anti-thyroid hormone. Don't want it high when you're trying to live life. And it will impair T4 to T3 conversion. So that high cortisol will actually get in the way of your thyroid working properly. In addition to raising your blood sugar, and then you have more weight gain, and then you have more inflammation. So yeah, stress is a big component of your health in all aspects. All aspects. I mean, think about even for you, Sarah, with your clients, if a woman is stressed out, the body is smart enough to not allow for conception because that's not a good environment for a baby to grow. So if a woman is high strung, stressed out, again, that high cortisol state all the time, that's going to affect fertility, hands down. I'm sure you see it all the time.
Absolutely. So we take a mind, body, spirit approach to this, right? So the biochemical and also, yeah, exactly. Addressing, the belief and the whole culture of IVF where, there's that panic culture. And so so how often would you test the labs, and then medication? What's your take on when we use it? Obviously for the functional approach, we never use it by itself. That's just a Band-Aid. The conventional, you go to your conventional doctor, they send you off with a Synthroid, or maybe even they give you maybe a desiccated thyroid as well. And then they send you off and they don't tell you to do anything else. But so we're assuming we're going to be doing those targeted diet and lifestyle changes. Yeah. When do you bring it in, and how often are you testing? What are you seeing?
So I have a both and saying. I always say both and, meaning we look at your thyroid, we look at the numbers, we look at your symptoms. Oh my gosh, if your free T3 is in the basement, reverse T3 is high, and let's say you're already on thyroid medication, I'll adjust that. I have no problem. I call medication, thyroid medication, thyroid hormone replacement therapy. Just like if you were a type 1 diabetic and your pancreas didn't secrete insulin, you would take insulin. If your progesterone, estrogen, and testosterone in the tank, you would take bioidentical hormones, because we have that power now to actually replace hormones that are no longer being made by your body. I have no problem with thyroid hormones. And we also have to be doing the lifestyle changes, addressing stress, lowering insulin. I can't give you thyroid hormone and you be hitting McDonald's every day. That's not going to work. Oh, and then you're not sleeping and you're going to bed at 1 a.m. and you're over exercising and you're eating too many carbs and you're not changing your lifestyle in terms of like toxins and environmental factors. It's not going to work. Everything works beautifully and synergistically in the body when you do all the things. And then I always tell people, then you get bang for your buck. So that diet that you've been trying for the last year, you're actually going to get rewarded for your efforts for taking out the processed foods and going organic and lowering your carbohydrate. You're going to get and adding in good fat. You're going to get rewarded for that when we actually fix your thyroid and balance that out and address all these other lifestyle things over here. Everything will work together. When do we test labs? Every person is different. That's a question I get asked by every single patient. I say, listen, if we implement a new treatment plan, let's say we change your medication, we add it in, we do whatever. I can put a place marker at like 6-8 weeks, but that doesn't mean you have to wait. It doesn't mean that that's it. You better wait till that 8-week mark before we test you. No, I mean, if something is really wonky or if a person is experiencing symptoms, I mean, I'll test them at 4 weeks. I'll test them at 6 weeks. I see some people that they're like, yeah, my doctor told me to come back 3 months from now. Like, a lot can happen in 3 months. We might want to stay on top of that and check a little bit sooner. And then to catch things, if they are going sideways, let's catch them at the 6 to 8 week mark instead of the 12-week mark. So testing, it's very personalized. I get tested once a year. I'm optimized. I'm good. If I'm curious, I want to run another test on myself for whatever reason, I'll do it. But thyroid, I've been optimized for 15 plus years. So I just check it once a year. I check the box. Here's my labs. Please give me my thyroid hormone replacement therapy. Thank you. And it's just to please the insurance companies. But once you're optimized, you can stretch it out.
Yeah. So here, sometimes people think the goal is to get off the medication. So what is the goal around around the medication?
Yeah, that drives me crazy. Okay. So to which I say, all right, this is a long answer. Some people we can catch them in the beginning. We can catch them when everything starts. I have a woman right now, she's 67 years old. And really, we are kind of catching it in that early stage of, even at 67, early stage of Hashimoto's. The thyroid numbers are just starting to change. With her, I do believe we could use natural support, lifestyle changes, um, uh, balancing her hormones, lowering insulin. We can do all of those things, reducing inflammation, maybe using just a little bit of thyroid glandular. In that case, yes. Most of the time, when someone asks me, like, well, can I ever get off my medication? I go, if I get you feeling good and you're finally like, this is awesome. I'm not gaining 10 pounds looking sideways at a brownie. Yay, I'm pregnant. I had a healthy pregnancy. I lost the weight afterwards. Why would you want to get off of that? It's actually helping you. We finally got you optimized. And that medication is not doing anything except replacing the hormones that are no longer being made. So you have that subset, like you would literally have to pry my medication out of my dead cold hands before I went off of it. It's sustaining me. It's optimizing me. I have vitality and energy and I get through my day and I can have a little bit of glass of wine or I can have a gluten-free bun with my burger and not gain weight. So this optimization land is a really nice place to be. So once you're there, you really don't want to leave. So it's all dependent on the person. I'm not a huge fan. I don't advertise like, I will get you off of your medication, because you might not. That might be what is optimizing you.
And as far as medication, is there any specific brands that you like or ones that you're like stay away from? Anything that's you're staying there?
I get that question too. What's your favorite like medication? I say the one that works for you. The only thing I don't like is T4 only. It's probably literally 1 in 1,000, maybe more people do okay on T4 only. That's your Levo, Synthroid, Levoxyl, Tirosint. That's just T4. We already talked about how T4 has to convert to T3. So that's the only time that I don't really like someone on just T4 only, because they're going to continue to suffer. But other than that, it's whatever combination. And that's the beauty. I gave a talk years ago to the integrative wellness physicians that are here at LECOM, Lake Erie College of Osteopathic Medicine. And I did a whole presentation on why we need to test for reverse T3. And then I talked about the medications. I said, you guys are in the Synthroid box. I call it the Synthroid box. I said, if someone comes to you and they're depressed, you're going to give them this antidepressant. If that doesn't work, you're going to give them that antidepressant. If that doesn't work, you're going to put them on 2, and you're going to give them an anti-anxiety on top of that. But you only use 1 thyroid medication. Why? The doc raises his hand, goes, that's all we've learned. I'm like, well, all right, thanks for being honest. But do you know that there's so many different combinations? Like we have Armor, we have NDT, we used to have Natrothyroid, we have NP, or I'm sorry, I should have said not NDT because that's the whole big category. But we have Armor, we have NP, WP, we used to have Natrothyroid. We have the T4s, the Synthroid, the Tirosint. We can pair the T4 up with Leothyrene, Cytomel. That's T3. I call them biosynth because I hate the term synthetic. It's not like they're bad. They're not like synthetic birth control, synthetic hormones. They are identical to what's being made in your body. So we can combine those. We can use Armor with T3. I mean, we can do so many things to personalize the treatment to you. So it really is, my answer to my favorite is what's going to work for you.
And do you have a success story? I'm sure you have lots that you wanted to share with us.
So many. I got to tap into one. So one that stands out in my mind is actually she was a patient. She's now like my right-hand woman. I couldn't do without her. But she readily reminds me, she says, I saved her life, but she's saving mine right now by helping me. But her hands were so bad. So we focus a lot on weight. fertility, hair loss, low energy, and she had all of those. But one of the things that she suffered with for years were, and it wasn't RA, but her hands were so bad, she couldn't even hold a pencil. Like it hurt to write. It hurt to hold anything. She had knee pain and shoulder pain that she thought was, like overuse injury, or she'd have to go see an ortho for it. And once we got her optimized, gone, like gone. So, I mean, she did lose the weight. Her energy's back, she can, eat like a normal person. Well, she stays gluten-free, but she can enjoy treats and not gain weight and not gain 10 pounds looking sideways at a brownie. But the joint inflammation, the pain that she was experiencing, that's all tied back to the thyroid. And there's a lot of symptoms on the free guide that we're going to give people that are eye-opening. Frozen shoulder. I mean, just symptoms that you would go, oh my gosh, I have that. And I always thought it was XYZ, or my doctor told me it was this over here. And I got a Band-Aid medication for it. So it's pretty eye-opening how many conditions and how much the thyroid has a huge impact on the body.
Yeah, we think as we age, and even like people in their 30s having body pain, that may be common, but not normal. So definitely check out this lab checklist. I'll have the link in the show notes. Anything you would like to share about the checklist, Dr. Amie?
Yeah, no, that's just for you to look at the symptoms, check the boxes. I have people all the time going, do you know I checked every single box? I'm like, I know, I get it. But no, you check the boxes of the symptoms. They're very, very eye-opening. And then in there are all the labs that we talked about. So you don't have to worry about writing them down. All the labs that we talked about, along with their optimal ranges. So don't just get your labs back and go, oh, well, nothing has an H next to it. Nothing has an L to it. Nothing is red or flagged. You actually want to look to see if they are falling into optimal. And it's just really, really helpful for people to be their own patient advocate, because sometimes you have to be, sometimes you have to, and hopefully you are with a practitioner that is open-minded enough to say like, okay, yeah, I'll test that for you. My rule of thumb is if your doctor says no to testing, it's time to get a new doctor, because how in the world, if they won't even get the full picture to know what's going on with you, how are they going to help you afterwards? Do you really think you're going to get the right treatment? Probably not. So using that to be your own patient advocate is very, very helpful as well.
I agree. Any final thoughts on today's talk?
I always like to tell people to have hope, because like I said in the beginning, it took me 7 to get actually diagnosed and get an answer. What if I would have stopped? And how many people do? So your body, if something is off. If you are dealing with infertility, miscarriages, weight gain, weight you can't lose, hair loss, low energy, any of the symptoms, depression, anxiety, constipation, any of the symptoms that are in that lab and symptom checklist, then that is a sign from your body. We have to learn to tap into our own bodies more. That mind-body connection, we tend to blow it off, or stress gets in the way of us, being in tune with us and what's going on inside. So being in tune with your own body and listening when your body gives you a sign and a signal is imperative. And then keep going with that. If you get a no answer, if you get you're just getting older, you're normal, everything's fine. And you're like, oh, no, there's something going on. I know my body. Then keep going, keep plugging, look for answers, listen to podcasts, go on forums, reach out and look in functional medicine, because that's a lot of where the answers are. Look for somebody that actually specializes in thyroid hormones, infertility. You have to have that niche, and then you're going to get help. You're going to get help. Do not give up. You have to have hope.
I love it. Thank you so much for all the work you're doing. Awesome. Thank you.
Thanks for having me, Sarah.